And I'm here with Space Coast Daily. I'm here at the wonderful home of Michael Goldstein in Melbourne Beach, Florida. And Michael was a patient of Dr. Jeff Greenspoon, now with Viera Sports Medicine. And Michael's going to tell us a story to help some people in the future learn about the great procedures that are available out there for them. Michael, could you tell us a little bit about your background and your athletic experiences prior to the surgery?
Always played athletics, baseball, tennis, golf. Injured my right knee way back in 1969. They removed all of the cartilage, which then, of course, over the years, I was bone on bone. And I then, of course, injured my left knee back in 1998. Same situation, all the cartilage was taken out, where eventually I was just bone on bone, and I had to eventually replace both knees.
Okay, and then you found Dr. Greenspoon, and he described a procedure for you. What sort of preparations did you have prior to the surgery, and tell us a little bit about the surgery itself.
Dr. Greenspoon suggested that prior to the first surgery that I lose as much weight as possible, which would aid me in the rehabilitation progress, which I did. I lost about 45 pounds. We did the first knee in March of 2007. I rehabbed that one, and then we did the other knee May of 2007. Rehabbed that one, in which I was able to walk through the Orlando International Airport without a cane or a crutch in July. So
fantastic.
The weight loss, I think, really helped the rehabilitation process.
Sure. And then tell us about the rehab after the surgery, and then your sort of a time of, was there any pain involved after the surgery?
Quite a bit. I mean, there's no more pain than any other evasive surgery that you're going to have, but the pain basically was associated with the rehab process, rehabbing both knees. However, with the weight loss and seriously rehabbing, which I would do a session in the morning, a session in the afternoon for about 8 weeks, the pain, of course, resided. And today, I play tennis 3 or 4 times a week, and I'm 100% pain-free. That's
wonderful. And so, any friends of yours or acquaintances you would recommend Dr. Greenspoon as far as this type of procedure?
Absolutely. I would recommend Dr. Greenspoon for any orthopedic need, especially within the knees. But I also recommend him because he just doesn't replace a knee to replace a knee. He actually looks at each case individually. And at the last resort, if that's what's needed, that's what it's done, because there's a lot of alternative ways for minor knee pain versus somebody like me who had pretty major knee issues.
Well, Michael, thank you so much for sharing your story with us. I'm sure people will find this very interesting, helpful, and you're a remarkable man. You're sort of the poster child for getting this sort of thing done. You look very well and healthy, and you're living a very active lifestyle here in beautiful Florida. We want to thank you very much for your help today.
Thank you.